Welcome to the Depth Dive. Today, we're looking into avian influenza, H5N1. Bird flu.
Right.
It's definitely moved into the spotlight recently.
Yes, it have.
We're seeing some pretty major developments, particularly that first confirmed human case down in Mexico.
And the spread in animals globally, that's also a big piece of this.
Exactly. So our goal here is to really break down the key facts for you. We've got info from the WHO, Nature, the CDC, ABC News, and a documentary overview.
Basically trying to understand the risks, what it all means.
Okay, so let's dive in. That first human case in Mexico. What happened there?
Well, the WHO report confirms it was the first lab-confirmed human case of H5N1 in Mexico. Happened in Durango.
Okay.
And what's really striking, I think, are the details. It involved a child under 10.
Oh, wow.
Yeah, with no underlying conditions, hadn't had a seasonal flu shot. Tragically, the child passed away from respiratory complications.
That's awful. And no travel history, right? That seems important.
That's right. No travel history. Really points towards a possible local source of infection.
And the timeline, symptoms started in early March, but things progressed and the death was in April. That seems like a while.
It does. And it kind of highlights the difficulty sometimes in diagnosing these novel flu viruses. The initial symptoms can look like a lot of other things.
Makes sense. What about the response? Did they find other cases?
Well, they did extensive contact tracing, tested 91 people, family, healthcare workers, daycare contacts.
Anyone? Okay.
And the good news, if you can call it that, is that no other confirmed cases were found in that cluster.
That's somewhat reassuring, at least regarding immediate person-to-person spread there.
Yes, but it still leaves a question of how that initial infection happened wide open.
Which leads us back to the animals, doesn't it? Mexico's had bird flu and poultry for a couple of years.
Exactly. Since 2022, outbreaks in various states. Jalisco, Yucatan, quite a few.
And specifically in Durango, where the child lived.
Yes, and this is key. They recently detected the virus there in a sick vulture and also a dead Canada goose.
Ah, okay. So that strengthens the link to a possible animal source?
It certainly suggests it. The investigation is ongoing, but it fits the pattern.
So the WHO says the risk to the general population is low.
Low, yes, but low to moderate for people with occupational exposure like farm workers. That's where the focus needs to be.
Right. And these kinds of cases, they have to be reported internationally.
Absolutely. Under the international health regulations, any human infection with the new influenza, a subtype, is a notifiable event. It triggers a global alert.
Okay, so that's the specific Mexico situation. Now, let's widen the lens. You mentioned the global spread and animals earlier. Our sources, ABC News and the documentary, really dig into this. It's way beyond just poultry now, isn't it?
Oh, absolutely. It's quite staggering, actually. H5N1 is widespread in wild birds. We know that. But the big shifts are the major outbreaks in poultry globally and, crucially, in U.S. dairy cows.
The dairy cow situation feels like a major development.
It really is. The
Yeah.
CDC numbers are pretty stark. Over 13,000 wild birds detected in the U.S. across, well, almost everywhere.
Wow.
And poultry. Over 171 million birds affected. That's huge economic and agricultural impact.
171 million.
But yeah, the dairy cows, over 1,000 herds affected now in 17 states as of late May. That's a game changer.
Why is the spread in cows so significant? What's the concern there?
Well, it's about adaptation, really. The virus is now circulating effectively in a mammalian species on a large scale.
Giving it more chances to change.
Exactly. More chances to pick up mutations that could potentially make it better at infecting other mammals, including, us.
And this isn't just a U.S. thing. The documentary in ABC mentioned South America, even Antarctica.
Yeah, that's the other really concerning part. The geographical reach is unprecedented for this strain. South America has seen devastating losses since 2022, over 600,000 wild birds, 50,000 mammals.
50,000 mammals.
But Antarctica, that was a real shock. It's reached the continent and is infecting seals, pinnipeds.
Seals. Goodness.
Elephant seals, specifically, with high mortality. And king penguins, too. They're seeing neurological issues, respiratory problems.
That's just jarring, thinking about it in such a remote, pristine environment. And I remember the piece mentioning penguins might be carriers without symptoms?
That's the worry, yes.
Yeah.
If they can carry it asymptomatically, they could become a sort of silent vector, spreading it further within Antarctica or even helping it bridge to other places via migratory birds.
So potentially reaching places like Australia.
That's the fear. It's already on subantarctic islands. Australia is definitely on high alert, boosting surveillance, investing heavily in preparedness. It really shows how interconnected everything is.
It really does. A virus-jumping species, crossing continents, reaching the ends of the earth. Okay, so bringing it back to the human side of things, what are the CDC and others saying about human cases, particularly in the US, and the overall risk?
Well, the CDC noted over 70 human cases in the U.S. as of May.
70. That sounds like a lot.
It does. But context is key here. The vast majority, almost all, are linked to farm workers, people with direct exposure to infected animals, especially dairy cows now.
Okay, so direct contact is the main route.
Yes. And symptoms have generally been mild. Conjunctivitis, like pink eye, has been common. Some respiratory illness, but mostly mild.
Mostly mild, but there was a death, right? In Louisiana.
Sadly, yes. One fatality was reported in Louisiana, so it's not entirely without severe outcomes, even if most cases are mild.
And despite these cases, the CDC's general surveillance isn't picking up wider community spread.
Correct. Their systems, which monitor flu activity broadly, aren't showing anything unusual in the general population right now, which is obviously good news.
But looking globally, the WHO data paints a more severe historical picture, doesn't it?
It does. If you look back from 2003 up to April this year, globally, there have been nearly 1,000 cases, 972 reported. And the fatality rate associated with those historical cases is high, around 48%.
Wow, nearly half.
Yeah. But again, almost all linked to very close contact with infected birds or contaminated environments, not from casual contact.
So the big underlying fear, the reason for all this vigilance, it really boils down to the virus changing, right? Gaining the ability to spread easily between people.
That's the core concern. Sustained human-to-human transmission. We've seen very limited instances in the past with H5 viruses, isolated clusters, but nothing sustained.
And the worry is it could mutate to do that. The documentary mentioned pigs as mixing vessels.
Right. That's a long-standing concern in influenza research.
Mm.
Pigs can be infected by both bird flu and human flu viruses simultaneously.
Ah, so they could mix and match genes.
Potentially, yes.
Yeah.
It's called reassortment.
Yeah.
You could theoretically get a new virus that has the pandemic potential of easily spreading between humans, but carries the severity, perhaps, of an avian strain. It's a theoretical risk, but a serious one.
And we've already seen some mutations in recent human cases that are, well, concerning, like that Louisiana case.
Yes, that case did show some genetic markers suggesting, let's say, early adaptation to mammals. Not full adaptation, but steps in that direction.
So every time it jumps to a mammal, it's like another roll of the dice.
Essentially, yes. It's another chance for the virus to learn, to evolve. And the fact that the U.S. dairy cow outbreak has been going on for a while now.
That delay in containment.
Exactly. It means the virus has had more time circulating widely in the mammalian population, more opportunities to acquire those potentially dangerous mutations.
And there were also worries about cases maybe being missed, especially among vulnerable workers.
Yes, concerns about underreporting, particularly among migrant dairy workers who might face barriers to healthcare or fear repercussions. That could mask the true extent of human exposure or early signs of adaptation.
It's a complex picture with some unsettling possibilities. Okay, so given all that, what's happening with vaccines and public health measures? Nature, WHO, CDC, all had information on this.
Well, on the animal front, there's actually some quite promising news. The Nature article talked about cattle vaccine development.
For the cows.
Yes. An mRNA vaccine, similar technology to some COVID vaccines, showed good results in early tests on calves, protected them, generated a good immune response.
That's encouraging.
It is. And trials in lactating cows, the ones actually producing milk, are underway now. That could be a really important tool for controlling the spread in livestock.
What about human vaccines? Do we have anything ready if things get worse?
We do have several candidate H5 vaccines developed for pandemic preparedness. Stockpiles exist, but availability is limited currently. They're constantly updating these based on circulating strains.
So they're trying to stay ahead of the curve.
Trying to, yes. And importantly, the WHO and CDC emphasize getting your seasonal flu shot if you work with animals.
Even though it doesn't protect against bird flu directly.
Right. It's not for direct protection against H5N1. It's to prevent you from getting human flu and bird flu at the same time.
Avoiding that mixing vessel scenario within a person.
Precisely. Reducing the chance of co-infection and potential reassortment.
Makes sense. And for the general public, what's the advice?
Pretty straightforward, really. Avoid sick or dead animals, wild or domestic. Report them to authorities.
Yeah.
Cook your poultry and eggs thoroughly. That kills the virus. And importantly, avoid raw milk. Pasteurization kills the virus, but raw milk is a potential risk now with the cow outbreaks.
Right. Pasteurization is key.
Absolutely. And for those working in poultry or livestock industries, strict biosecurity, using personal protective equipment, masks, gloves, eye protection is crucial.
So, heightened surveillance, specific advice for at risk groups, and general precautions for everyone. Seems like a layered defense.
It has to be.
Right.
And that mandatory WHO reporting for any human case means the global system is watching very closely.
Okay, so wrapping this up. It feels like, yes, the immediate risk to you, the general public, is still assessed as low. That's important.
Very important to state.
But this deep dive really shows a situation that's complex and, frankly, evolving rapidly. That first human death in Mexico, the sheer scale of the animal spread cows in the US, seals in Antarctica. It's a lot.
It really underscores the unpredictable nature of these viruses. The jump between species is happening frequently now.
The cattle vaccine development offers some hope on the livestock side, which is good.
Definitely a positive step.
But clearly, we need continued intense monitoring of how this virus is changing, especially regarding any signs of better transmission between mammals.
Absolutely critical. This whole situation highlights just how linked human health and animal health are. We can't separate them. Global surveillance, preparedness, they're not optional.
It leaves you thinking, though, what does it really mean long term for this virus to be adapting to so many different mammals? Seals, cows, humans. What happens next in that evolutionary story?
That's the million-dollar question, isn't it? And
Yeah.
we don't have the answer yet. It just underlines the need to stay informed and vigilant.